Hello, I am Dr. Sigdel. I'll discuss today about some granulomatous disease of the nose. First up one is sarcoidosis. It is synonymous to weak sarcoid. This is the chronic systemic inflammation of unknown etiology. If you see here, this is from the non-caging hard granulomatous inflammation that affect the most of the organ. You'll see here, this most of the organ involved by this kind of disease. Etiology, exact etiology unknown, but yes, we got some chemical like beryllium, zirconium, and pine pollen, peanut dust are possible contributing factor. Okay. Next issue we have to discuss here is involvement of the lymph node, skin, lung, eye, liver, spleen. These are the organs affected. Sometimes it is a small bone of the hand also affected, hand and feet. Okay. Next, disease typically manifests into third to fifth decade of life, around 30 to 50 years. If you see the clinical feature, it presents with depending on the organ system involvement. Organ system involvement. Nasal manifestation include there is a granular appearance. If you see here, there is a redness here. Okay, some white is glistening area of the mucosa. Okay, that is strawberry skin. Strawberry skin. This is the strawberry skin. This is the nose. This kind of passion feel with the nasal stuffiness, nasal obstruction. See the percentage, that is more than 80%, 88%. Second common symptom is crusting. There's so many symptoms like discharge, purulent discharge, facial pain there, but prominent symptoms are nasal stuffiness and obstruction, then crusting. There should be sometime there is a soft mucosal nodule in the particular the nose. It is in the septum. This is the septum here or inferior turbinate. There is an inferior turbinate. This one is the septum. One of the most important phenomena here is lupus erythematosus. Look at this one. There's so much redness of the nose here due to sarcoidosis. It is a cutaneous lesion of the sarcoidosis, which is characterized by chronic variceous lesion. It is very sensitive to cold, especially if you see her nose. It may occur in the cheek, ear, also in the pink. Crispy described this sinonasal sarcoidosis into 3 stages. You can just know it. Reversible condition type 1, it is a paranasal sinus. If there is a moderate disease, limited to sinus involvement, that is stage 2. Stage 3 is irreversible disease. There may be synechiae or nasal sarcoidosis. Sometimes there is a cartilage destruction too. There are so many organs affected. If you see, most prominent organs are peripheral lymph node by 73%, liver 21%, eye is 21%. If you see, these are the most common organs. Other are spleen, bone, etc. What is the immunology and pathology of this type of disease? You have to remember this one. This is a type 4 hypersensitivity reaction. Histopathologically, we found granulomatous composed of epithelioid cells surrounded by lymphocyte and fibroblasts without caseation. This is called Schaumann bodies. Schaumann body. If you see the Schaumann body, this is a lesion here. Okay, and this is one of the epithelioid cell, multiple epithelioid cell you can see. There is a fibroblast. There is no caseation here, but there is you can see here there is a crystalline calcified inclusion body is seen here. It is not exclusively diagnosis for the sarcoidosis, but it can be observed in the other condition like fungal disease or borreliosis. What is the diagnostic method? It is a combination of histology, imaging, hematology, and clinical finding. What we found that there is an increased level of angiotensin converting enzyme in the acute phase of the disease in sarcoidosis. Other thing is there is an increased ESR rate and elevated serum urine calcium. So in blood test, we have to find three things. One, AC level increase, other ESR increase, other is next one is elevated serum and urine calcium. Imaging study is very, very crucial here. Chest X-ray is give the staging of the disease. Everybody should know. Stage 1 bilateral hilar lymph node should be present. Stage 2 lymph node, bilateral hilar lymph node plus diffuse parenchymal disease. Stage 3 there is a diffuse parenchymal lymph infiltrate without hilar lymph node. Stage 4 there is a fibrosis or pulmonary with diffuse parenchymal infiltrate. So diffuse parenchymal infiltrate is occur from the 2, more 3, and 4. There is a more fibrosis here, but bilateral hilar lymph node is 1 to 2. Remember like this. If you see this X-ray, you can see some hilar lymph node enlargement here. CT scan. This is the typical finding in the CT scan of the sarcoidosis. Here is, you can see nodular thickening of the peribronchial perivascular intestine. Nodular thickening. You can see small nodule here, here. You can see here. Okay, you can see here. These are the peribronchial and vascular area. Taken from Nestor Miller. CT scan knows, especially see sclerosis and osteolysis here of the nasal bone. You can see here nasal bone in this area. Here, this is the nasal bone. There is a sclerosis and osteolysis. Bony shadow is lost here. There may be here you can see the soft tissue mass. X-ray, plain X-ray indicate a rarefaction of the punctate osteolysis. How you treat this kind of nasal involvement disease? These are the rare presentation which is emphasized as Mukhadar or Majidel. Sarcoidosis should be treated with the prednisolone 40 mg per day with hydroxychloroquine, which is 400 mg per day. There is a dramatic involvement of which is involving the nasal bone, pulmonary area, and skin lesion within a week. This article is published in 2016. MRI is utilized to do the neurosarcoidosis share. Biopsy, yes, essential, confirm the diagnosis, which is so non-causative granuloma. Diagnostic criteria, especially mentioned chest X-ray, is very, very important here. It's so diffuse pulmonary involvement with bilateral hilar adenopathy. And nasal biopsy confirmed there is non-causative granuloma, but one should exclude the other cause of gallbladder disease. Nasal sarcoidosis treatment approach, yes, we have to give systemic therapy, combination of steroid, methotrexate, hydroxychloroquine. Local treatment, yes, intranasal steroids, there is a role. People are trying glycerol and glycerin. Nasal dosing, of course, every patient should do it, need it. Do it or need it. Okay, surgery is generally contraindicated in active disease. However, endoscopic sinus surgery is performed in secondary bacterial infection. That much enough for today. regarding sarcoidosis, especially focus in the nasal sarcoidosis. Thank you.